Hello, so my presentation on the interventions to combat anemia in Mexico and Egypt. Today, I'll explore the public health interventions at primary, secondary, and tertiary levels while also discussing social determinants and environmental factors in each country. So, anemia affects millions in both Mexico and Egypt, though the causes and prevalence can vary. In Mexico, the population is significantly affected by nutritional deficiencies um, and parasitic infections, while in Egypt, the problem is compounded by similar nutritional issues but also by diseases such as schistosome schistosomiasis. Um, Primary prevention in both countries focuses on improving dietary intake and reducing iron deficiency through supplementation and food fortification. In Mexico, national fortification programs have made a significant impact. In Egypt, um, bread fortification and community education have been crucial. So, secondary interventions focus on early detection. In both countries, health systems emphasize screening children and pregnant women, where early intervention with iron supplementation has been shown to reduce anemia prevalence. Tertiary interventions focus on treatment of severe cases, so both Mexico and Egypt provide critical care through hospital treatment, including blood transfusions and iron supplementation for individuals with severe anemia. Both countries must address human rights concerns, ensuring access to health services for marginalized and vulnerable groups. This includes addressing gender disparities and providing equitable care in rural areas. Both countries face socioeconomic and environmental challenges. In Mexico, poverty and food insecurity are major contributors. In Egypt, access to clean water and sanitation, along with economic disparities, play a key role in the prevalence of anemia. Funding for anemia interventions comes from both governmental sources and international organizations. In Mexico, national programs are complemented by international contributions. In Egypt, both domestic and global donors, like the Global Fund, support efforts to reduce anemia. Um, so, future interventions in both countries should focus on strengthening partnerships for food fortification and expanding healthcare infrastructure, particularly in rural areas, to reduce the burden of anemia. Both Mexico and Egypt face challenges in overcoming anemia, including healthcare access, economic inequality, and inadequate public health infrastructure, especially in rural regions. International organizations are key in providing funding and technical support. In Mexico, UNICEF and the World Bank help implement food fortification programs. Similarly, in Egypt, global funding supports initiatives aimed at both treating and preventing anemia. So, um, in conclusion, addressing anemia in both Mexico and Egypt requires a comprehensive approach that involves primary, secondary, and tertiary interventions. Primary efforts like iron supplementation and food fortification can reduce the risk of anemia at the population level, while secondary interventions such as screening ensure early detection and intervention. Tertiary care focuses on treating individuals with severe anemia through hospital based treatments. In both countries, human rights considerations play a crucial role in ensuring that vulnerable populations, particularly women and children, have access to healthcare services. Socioeconomic factors such as poverty and limited access to healthcare continue to present challenges in combating anemia. Both Mexico and Egypt must continue to address economic disparities and improve access to nutritious food to make a long term progress. Um, International funding remains essential for supporting these interventions, whether through global organizations like the World Bank or region specific initiatives like the Global Fund. By collaborating with both local and international stakeholders, we can significantly reduce the burden of anemia in these countries, improving health outcomes and contributing to broader goals of global health equity. And then lastly, just a list of references and what sort of information I was able to attain from them.